Welcome and thank you for standing by. My name is Megan Walters, and I am a health policy analyst with the National Center for Health Statistics. I am pleased to introduce today's speaker, Dr. Carla Zelaya. Dr. Zelaya works as a health statistician in the Data Linkage Program at the National Center for Health Statistics, NCHS, which is in the Centers for Disease Control and Prevention. Dr. Zelaya has a PhD in epidemiology from the Johns Hopkins Bloomberg School of Public Health and a master's in control of infectious diseases from the London School of Hygiene and Tropical Medicine. This webinar will present an overview of the NCHS Data Linkage Program, including how to access data files, highlight its newest data resource, and discuss how these new linked data can help answer critical health policy questions about the health of U.S. veterans. And now I turn it over to our presenter, Carla.
Good afternoon, everyone. In this talk, we're going to give a brief overview of the NCHS Data Linkage Program. Then we're going to focus on the recently released linked NCHS Department of Veterans Affairs data. These data products are wonderful examples of interagency collaborations and data sharing to create new resources to understand the health of the veteran population. I wanted to start by providing a bit of background about NCHS. We are the nation's principal health statistics agency and one of 13 federal statistical agencies. We are part of the Centers of Disease Control and Prevention, and we are located outside of Washington, D.C. Our mission is to provide timely, relevant statistical information that can be used to guide actions and policies to improve the health of the American people. The NCHS Data Linkage Program creates linked data files that support high-quality research and program evaluation. Our methodologists work hard to continuously improve the processes for linking data, for example, our linkage algorithm, and to improve methods for evaluating data quality. We also provide detailed documentation to support the analyses of the linked data files. In our group, we also explore innovative methods for maintaining researcher access to linked data. For example, the creation of synthetic data. So why do we link? To address the most pressing public health concerns, many policy-relevant questions require complex and detailed data. Planning primary data collection to answer such questions may not always be feasible. One role of a federal statistical agency such as NCHS may be to individually and collectively use data most effectively. Therefore, one question we are faced with is, how do we leverage existing data sources to address pressing policy questions while also being at the forefront of tackling health emergencies? One way to tackle these questions is to integrate data. Linking data is a powerful and efficient mechanism for producing policy-relevant information. Therefore, in the NCHS Data Linkage Program, we bring together information about the same person or entity to create a new, richer dataset or datasets. This also allows for the construction of longitudinal events in previously cross-sectional datasets. In our work, we pay careful attention to quality, relevance, and utility. We prioritize protecting privacy while focusing on accessibility to data users, and of course, transparency in our methodology. In this slide, we briefly outline our NCHS surveys included in our linkages. The National Health Interview Survey, which we call the NHIS, and the National Health and Nutrition Examination Survey, which we call NHANES, are large nationally representative household surveys that collect a wide array of health-related information. NHANES also includes a detailed physical examination component. The examination component consists of medical, dental, and physiological measurements, as well as laboratory tests. Both NHIS and NHANES have a complex survey design, which needs to be accounted for in any analyses. Lastly, we link to data from the National Hospital Care Survey, which brings in critical patient data from electronic health records and claims data from sampled hospitals. You can find detailed information on each of these surveys on the NCHS website. In this presentation, I will mainly focus on linked NHIS and NHANES data. The household surveys, namely NHIS and NHANES, which I have just introduced, collect a vast amount of information on health behaviours, such as smoking or alcohol use, health conditions, such as chronic pain, socioeconomic status, such as income or education, and healthcare access and utilisation. For example, the NHIS is well known for its collection of comprehensive information on health insurance, whether it be public, private, etc. These data are, however, cross-sectional, with no longitudinal information and limited contextual information. In the Data Linkage Program, we bring in administrative data, which is depicted on the right, which provides follow-up or other important contextual information on survey participants. Linking the administrative data to survey data, which has a known sampling frame and known inference, we allow researchers to augment available follow-up and contextual information, such as receipt of housing assistance, for example, by the presence of chronic conditions, health risk factors, or health service utilisation, which we collect from the surveys. We can also link exposures to outcomes such as mortality through our collection of National Death Index mortality data. And this provides a longitudinal component to survey data. So how do we link? All recent linkages have been conducted with two sequential approaches, deterministic and probabilistic, to link participants with administrative data. The deterministic linkage is conducted first, joining on exact SSN, and it is validated by comparison of other identifying fields. These linked records make up a truth deck to be used later to test models used to create probabilistic link matches. The subsequent and second stage is the probabilistic approach, which performs weighting and link adjudication following the Foley-J-Sunter method. Pairs having the highest estimated match probability are kept as long as they are above the set linkage probability cutoff or threshold. The linkage probability threshold is determined by minimizing type 1 and type 2 errors. Pair scores are calculated on the agreement status of the identifiers, such as name, state of residence, and date of birth. During the probabilistic matching, SSN, when it is available, is used to measure linkage accuracy. However, it is not used in scoring the pairs during the second stage of the linkage process. This graphic summarizes the scope of additional data that NCHS has added to its survey data collections. To date, we have linked the NCHS survey data to the National Death Index mortality data with a maximum of 33 years of follow-up for some surveys. We've also linked CMS linked data, meaning Medicaid and Medicare, with a maximum of 25 and 24 years of follow-up respectively. Additionally, we have housing and urban development HUD data with up to 20 years of follow-up. And lastly, for our new linkage with the Department of Veterans Affairs, VA, we have up to 16 years of follow-up. We are now going to focus on this newest linkage with, and this is the first linkage of NCHS survey data with the VA administrative data. Through linkage of the NCHS and VA data was conducted through a collaborative agreement between NCHS Data Linkage Program and the VA. The VA data included comes from the United States Veterans Eligibility Trends and Statistics, US VETS database, which was prepared by the Office of Data Governance and Analytics within the Office of Enterprise Integration at the VA. This US VETS database consists mainly of data sources from the VA administrations and the Department of Defense, and it contains information on all US veterans, including their military history and their utilization of VA benefits and services. The linked NCHS data includes the 2005 to 2018 NHIS sample adults and the 2005 to 2018 NHANES participants aged 18 and over. We are also linking to the 2016 NHCS restricted data files, and these additional files will be available later this fall. This linkage was supported in part with funding from the CDC Data Modernization Initiative. I would like to take a moment to review some types of research that can be conducted with these new linked files. Researchers could potentially look at health behaviours, health outcomes, and determinants of health by, for example, veteran status or age group of veteran. We could also assess group differences in healthcare access, for example, insurance coverage collected by the NHIS, preventative care such as immunization, or chronic conditions such as chronic pain by VA healthcare enrollment status, whether you're enrolled in the VA or not, or by VA benefit program utilization status in any given fiscal year. Given the survey information on sex, race, ethnicity, urbanicity, and other social determinants of health, the data will be well suited to health equity research and informing VA policy. This slide illustrates the timing of the survey data and the administrative data. For the NHIS and NHANES linked to VA administrative data, we have included survey data from 2005 to 2018. And this will be linked to VA benefit program utilization data from 2005 to 2020. We will have files with a temporal component, including information from the VA before, after, and concurrently to the survey. So before the survey was conducted, after the survey was conducted, and also concurrently to the survey. While the VA benefit program utilization data is from 2005 to 2020, we also, I would just like to highlight, we have the service history information, which may go back a lot further, but is up through fiscal year 2020. Now let's take a look at some of the sample sizes and match rates. By match rates, I mean the percent that linked for the VA data files. Just like to remind you, this linkage is only amongst adults aged 18 and over. In this table, we can see that sample adults from the 2005 to 2018 NHIS by sex and age. Only NCHS survey participants who have consented to linkage and have the necessary personally identifiable information, PII, are considered linkage eligible. You can see that over 80% of sample adult participants were linkage eligible, and that overall about 8.8 or 9% of linkage eligible participants matched to the VA administrative data files. By matching, this indicates that they were veterans. When you look at the breakdown of sex and age, the percentages shown correspond very closely with the published statistics on the veteran population in the US by sex and age. With the NHIS, you can expect sample size of approximately 2,000 veterans a year in the linked data files, with earlier years having a slightly higher sample size. For more detailed information on the sample sizes and match rates for the NHIS, please refer to the link listed on this slide. Now, when examining the match rate tables available for NHANES, we can see very similar percentages eligible for linkage and the percentages eligible who linked. However, it is important to note that NHANES sample sizes are inherently smaller by design, with approximately 500 veterans linked in each NHANES cycle. And this translates to about 3,500 in total from 2005 to 2018. Due to the smaller sample sizes, planned analyses may not be able to be stratified by both sex and age together, and this should be taken into account when planning your research proposals. We have 3 linkage files just released, and the first of these linkage files is the match status file. The match status file includes information on which survey participants linked to VA administrative data, and this is done through the match status variable. This file contains one record for each 2005 to 2018 NHIS sample adult and each 2005 to 18 NHANES participant aged 18 and over. Other variables in this file include the linkage adjusted sample weights, which accounts for the potential bias introduced by linkage ineligibility, and also the match probability. This estimates the probability that a given pair was a match. second file we have released is the service record file. This includes information detailing military service in the US uniformed services. The file contains one record for each linked participant or veteran. The information will go through 2020, but there is some information on this file that may go back much earlier because it is concerning a participant's military service record. Variables include branch of service, character of service at discharge, era of service, and we also have race ethnicity information from the VA administrative records. The last file provided is the VA utilization file. This file includes VA administrative information, and due to data availability, it is for administrative years 2000. Administrative years from fiscal years 2005 to 2020. There is one record for each linked participant. In other words, one record for each veteran. Variables are provided for each fiscal year included. Variables include the healthcare enrollment priority status for VA healthcare, the number of service-connected disabilities, VA healthcare enrollment, a dichotomous yes-no variable, and benefit program utilization. The benefit programs included in the file are VA healthcare, service-connected disability compensation, pension, VA guaranteed home loan, life insurance, education training, and veteran readiness or vocational rehabilitation and employment. So for example, for VA healthcare utilization, there'll be 16 variables indicating whether or not a veteran has utilized VA healthcare in each fiscal year from 2005 to 2020. I would now like to discuss the timing of benefit program utilization in relation to the NCHS survey. NCHS survey data are linked to multiple years of VA administrative data. VA benefit program utilization may be available for survey participants concurrently to, before, or after their survey interview or exam for NHANES. The surveys are conducted on a calendar year basis from January through December. And as I have mentioned, the VA administrative data in the utilization file are organized by fiscal year, October 1st to 3030. So if you would like to analyze concurrent VA utilization information for the 2015 NHIS, you would need to use fiscal years 2015 and fiscal year 2016 variables. The reason for this is that if an interview occurred in Q4 2015, then the corresponding fiscal years in the VA data would be 2016. So that is why you need to take into account both fiscal years of data if you're looking at one calendar year of survey data. I would now like to briefly discuss how you access these newly available linked data files. The NCHS VA linked data files will be available through the NCHS Research Data Center, RDC, and federal statistical RDCs managed by Census. There are currently 30 open federal statistical research data center locations. Please refer to the website provided on the slide to learn more about the process for preparing a proposal to access the linked data. When you're preparing a proposal for the RDC, I would like to help that process, I would like to highlight some variables that you might want to consider for inclusion. You might want to include the sample weights and design variables, which are needed to account for the complex design of the NCHS surveys. You will want to think about what demographic information you want, such as sex, age, race, ethnicity. And you'll have to think about whether you want socioeconomic information, such as income and education. You will also want to think about whether you need information on the date of the survey. For NHANES, month and year of examination and interview are restricted use variables. So if you need them, you will have to put that in your proposal. For NHIS, the calendar, quarter, and year of interview are on the public use files. Remember, if you are interested in the alignment of VA benefit program utilization with calendar year of survey participation, you need to request both fiscal year variables associated with each calendar year. I would like to look back to the beginning of my talk when I discussed all the linkages in our program. These are all the linkages that are available. Once an NCHS survey is linked to one specific administrative data source, then it's also possible to combine data across linkages. For example, if mortality outcome information is of interest, the NDI data will also be available to those who, for example, are primarily interested in the NCHS VA linked data files. Additionally, we have geocoded addresses. So this can add to more basic information, geographic information that is available from the public and restricted use survey data. I would like to emphasize that the NCHS linked data files really do create a full picture for the people linked, bringing in both health utilization information, for example, from CMS, Medicare, Medicaid, and contextual information from, for example, the Department of Housing and Urban Development, HUD. I would like to make a few summary points. The NCHS Data Linkage Program continuously updates and maintains linkages between NCHS survey data and administrative data. We are really pleased to announce that the 2005 and 2018 NHIS and the 2005 and 2018 NHANES have now been linked to the VA administrative data, and the data files are now available through the RDC. NCHS VA linked data files provide a policy-relevant resource that combines information on health characteristics and access to care with veteran status, service history, and VA program utilization. I would like to finish my talk by giving you our contact information. On the slide, you will find our email and our website. And if you subscribe to our listserv, you will get updates on new linkages, updates to existing linkages, and other information. So I highly recommend you subscribe to our Data Linkage Program listserv. And with that, I will hand back over to Megan, and thank you so much for coming today.
Thanks, Carla. We are now entering the question and answer session. As time allows, the presenter will address questions from the Q&A box. Please submit your questions through this feature now. If your question or comment is not addressed today, please direct it to paoquery@cdc.gov. First, we will start with, what is the population included in the linkage? Is it just veterans that are enrolled in VA healthcare?
So for our linkage, we include all sample adult NHIS participants and all NHANES participants aged 18 and over. So just to remind you, to link, you have to be linkage eligible. So you have to consent and provide the necessary PII. The US Vets database, which we link to, is all US veterans. Therefore, if a linkage eligible participant links to the VA data, that is an indication that the participant is a veteran. The linkage files include survey participants that linked, about 9% of participants. And then the resulting files, there's 3 files: the match status file, the VA service record file, and the VA utilization file. The match status file will have all of the participants that are in the linkage, and will have a variable to say if they were eligible and if they linked. So that's all survey participants. The second file, the service record file, and the VA utilization file contain all the linked participants. That means veterans. It's not whether they are in VA healthcare or not, it is all veterans. Therefore, the weighted estimates are representative of the US veterans, regardless of whether or not they have VA healthcare or utilized any of the benefit programs.
Thanks, Carla. That's really helpful. We have a couple questions related to that. So hopefully that clears up who is included in the linked files with veterans. Our next question is, how much detail is in the VA utilization file?
Great. So the VA utilization file contains information for all the NHIS sample adults and enhanced participants who linked to the VA administrative data. So those are the veterans. It includes dichotomous flag variables for VA healthcare enrollment, yes/no variables, for each fiscal year from 2005 to 2020. It also includes information, for example, on the priority status for the linked participant, if they have one, for each fiscal year. And it can change throughout the fiscal years. For the benefit programs, such as VA healthcare or life insurance, for example, it is a dichotomous variable, yes or no, listed for each benefit program for each fiscal year. So you'll know within a fiscal year if somebody has utilized a specific benefit program. Therefore, we don't have specific information on their healthcare visits, for example, the type of care that they received, but rather we have dichotomous yes/no variables on whether they utilized benefit programs. And you can refer to the data dictionaries on the website for more information.
Thank you, Carla. We have an easy one here. Will the slides be available so we can get the URL links, etc.? Yes, the slides and a recording of the presentation will be posted on the NCHS website so that you can click through those links that Carla highlighted to access the data, as well as watch a recording if you missed something or wanted to look back at some of the questions. Is the linked file one complete dataset file for all eligible participants or separate smaller files?
So the first file that I talked about, the match status file, is one large file, and it has all the people included in the linkage. And there is a variable on that, the match status variable, that will tell you within those people who was eligible for linkage and who linked. So that's everybody together. The other files include only those that linked, the veterans that linked.
All right, thank you. Let's see here. What percentage of the linkage eligible respondents in the surveys indicate on the survey that they are a veteran? So then what percentage of the linkage eligible veterans are eventually matched and linked?
That's a very good question. And we have done some analyses of that, which are forthcoming. But we can tell you there's a high concordance between self-reported veteran status in the survey and linking to the VA administrative data. So we're really pleased with those results, and we'll get those out as soon as possible.
Okay. And now let's circle back to that question on who is part of the linked file. So this was a follow-up from that. It says, to follow up on that question, the base is survey participants. So the resulting files are not all veterans, but rather all survey participants and their veteran status and service details. Is that correct, Carla?
That is correct. We start with our survey participants, and we then link them to an administrative database called US Vets, which contains all US veterans. So our base is the survey participants. So what we end up with is survey participants who have linked, and that indicates their veteran status.
Here's another question for us. Can researchers link the cohort to other data sources beyond those that you've already mentioned in this presentation today, Carla?
In addition to what was mentioned, researchers can bring in geocoded data, but the PII used in the linkages are not made available for researchers. Our team is looking into expanding the sources that we link to, but that requires detailed agreements between agencies.
And I do want to ask this question here. How do participants in the surveys give consent for linkage?
Yes. Linkage consent is collected in a variety of ways, and it does depend on the survey. It's a little bit complicated. For NHIS, beginning in 2005 to 2006, NHIS consent was implicit specifically prior to 2007, eligibility for linkage was based on not refusing to provide a social security number. But from 2007 onwards, it was explicit consent. And also in 2005 onwards, we only required the last 4 digits of the SSN. So there was a short introduction asking for the SSN. And then for participants who declined to provide the last 4 digits of their social security number, they were asked an explicit question for permission to link to administrative records. So for 2007 onwards, providing the last 4 digits of your SSN or answering that you were willing to link without SSN was considered consent. There was another change in 2007 where we only included sample adults and sample children in the linkages for the NHIS. For NHANES, the consent procedures have also changed. SSN 9, social security number with 9 digits, has been consistently collected across the survey cycles for 2005 to 2018. Prior to the 2009 to 2010 cycle, eligibility for linkage is based on not refusing your social security number. However, beginning in 2009 to 10, NHANES participants were explicitly asked for consent to be included in the data linkage activities. I just want to also note that all linkages are approved by the NCHS ERB, which is equivalent to an IRB as well.
Thank you. We've got a couple more that have just come in. We have a question here asking, what kinds of medical information are available? For example, inpatient, outpatient diagnostic codes, procedure codes. And in addition to that, is this medical information self-reported, or does it come straight from the Veterans Health Administration data?
At this time, we don't have medical information. We have a service record, which is quite detailed on, for example, the era where somebody served, the character of their discharge, and we have program benefit utilization, which really is whether they've utilized program benefit programs, and also some detailed information on, for example, their priority rating for VA healthcare enrollment. We are, however, exploring the possibility of adding information in future linkages, and there's already been some interest on that from the VA.
Great. And if that person who's interested in those future data sets, if they sign up for your listserv, that's how they can get notifications when more data is available that might be interested to them?
Yep. Yeah, I think the listserv is a very good way to keep up to date with what is happening.
All right. Great. Thank you. Here's a question here about the National Health and Nutrition Examination Survey that we link to. What is the sample size of veterans in the NHANES medical examination sample, and what biomarkers are collected?
So I noted that there's about 500 veterans a year in the NHANES every 2 years for a cycle, which is 2 years. And I'm not quite sure right now the sample size for the examination. And we will consult with NHANES on the biomarkers. So I'll have to get back that information back to people.
Okay, we can always follow up via email on anything that we don't know right now. So once we consult with our NHANES folks within NCHS, we can get back to you with details on the biomarkers. Have you checked the number of VA who died by cohort? If yes, what is the impact on the record linkage outcome?
That's a very good question. This could impact the linkage, but if they were interviewed and on the US Vets database between 2005 and 2020, we would link to them. So you obviously have to be alive to participate in to be participating in the survey. And the US Vet, so the survey and the US Vet database years overlaps. So we will have all the death information up through, well, you would have to be alive to be participating up through 2018. And then we have the US Vets data up through 2020 for people.
Okay. And then in relation to that listserv, somebody asked, how can we subscribe to the listserv? So would you be able, can you click back
Yes.
and show that listserv slide? And again, these slides and the recording will be posted if you miss it now, but there is a description here. So I believe you just send an email message. Is that correct, Carla?
Yes, email a message to this list and list@cdc.gov and leave the subject line blank. And in the body of the message, you type these instructions. And this is obviously your last name and your first name.
All right, we'll leave that up for just a second so anybody can copy it down or go ahead and send that email so that you don't miss anything. I know just to give a little preview, this is the first of other webinars that we're hoping to do over the next couple of years as we continue to grow this program. So please subscribe to that listserv, keep an eye out on more webinars to be coming as we continue to grow the NCHS Data Linkage Program. And we do have another question here. Have you done any work to compare the overall population of veterans with veterans who are in the final linked database, for example, on their demographic or other characteristics?
Yes, similar to the other question. This report is forthcoming, but we are very pleased with the percentages so far. The distributions really do look similar.
Okay, looks like that is all we have for today. Thank you for your attendance and your questions in today's webinar. Again, a recording of this webinar along with Carla's slides will be posted on the NCHS website in the coming weeks. So keep an eye out for that and have a great afternoon.